I think of early on we had 2 or 3 of the first patients who required ventilators in the hospital, and seeing them eventually get strong enough and well enough that they didn't need the ventilator anymore, and then that were discharged. It was a real rewarding time to be able to see that people actually were getting better and were leaving the hospital. We recently had a couple of patients who were in their 90s who had survived a COVID infection and were in the hospital for a long amount of time, just getting their strength back and everything. Just amazing to see that they also left the hospital. So while there's been a lot of stress and misery related to this, there's also those rewarding times that I think people should remember. We have good health care here. We have the ability to take care of people and help them get better. And I think that speaks to what we did in the hospital, as well as people paying attention and being careful in the community and in the nursing homes in our areas, making sure to do things to keep each other safe. A lot of what we do is to protect ourselves when we're out in public, but these masks, wearing these masks is more about and washing our hands and not going to work or school if you're sick. That's about protecting people around us more than ourselves. So I think we have to give people in the community a lot of credit for that. I think a lot of us in healthcare have never imagined we'd see a day where we didn't have the luxury of going to the computer and ordering some endless amount of supplies for patient care. And that reality came home, and thankfully the people in our community stepped up to the plate and helped us with that. Out of nowhere, oh, here's 20,000 procedure masks oh, great. Or here's our supply of N95s that we usually use for this purpose, but go ahead and have at them. I think everyone understood what the gravity of the situation we were in the community, and was there to support us while we were doing our best to take care of them. I'd like to thank community members who were able to help us and who have been continuing to help us with supplies or donations, and that we're going to rely on that as we move forward to take care of people in the community. And the reason is, although we are continuing to acquire more PPE, we have not returned to normal in our ability to obtain a lot of PPE type equipment and other equipment used in healthcare. So though things are feeling a little bit normal right now, we are still not able to operate that way. And we're going to continue to rely on people's assistance in the community to make sure we have what we need. And so I really appreciate people being able to do that for us.